Hello everyone. Welcome to the FCCA Project CHOT training, session 2. Today we are going over the CHOT presentation by Rita Kanaze and also review the educational brochures. As mentioned, these are our agenda for today. We are starting off with the CHOT presentation by Rita Kanaze, and the second portion will be reviewing the educational brochures. First off, the CHOT presentation by Rita Kanaze. She will be going over the health impacts of climate change. Rita Kanaze is a former CHOT representative and a current FCCA volunteer. The aim of this demonstration is to show what we expect our volunteers to share and talk with community members.
Hello everyone, my name is Rita and I'm a volunteer with FCCA. I'll be presenting the following slides today. This presentation is specifically for the CHOT, the Climate Health Outreach Team. So FCCA, or Florida Clinicians for Climate Action, engages Florida health professionals to learn about the health harms of climate change and advocate for equitable solutions. Also, we engage and educate the community. So if we were presenting this presentation to medical professionals, we would have them do this pre-meeting survey, which basically just assesses their climate health knowledge. So essentially they would scan the QR code and fill out the Google Forms. And if we were presenting as a team, we would have our names with a picture of ourselves and where we're from as just a quick introduction for the medical professionals we are presenting to. So Florida Clinicians for Climate Action is a coalition of health professionals and health organizations. The coalition we are part of, that is locally, is the Miami Climate and Health Equity Coalition Group. And basically, it's a coalition of different organizations. FCCA is one of them. And they're concerned about the impacts of climate change on Florida residents, especially in vulnerable populations. So FCCA was established in 2018. We have over 200 members with monthly meetings. And our coalition, the Miami Climate and Health Equity Coalition Group, also has monthly meetings. And this is just a quick overview of our leadership team with Dr. Holder, as you guys have met, and Dr. Rhymes Johnson is also on here, and Carol. So how we work, FCCA is basically it engages, educates, and advocates. So we're engaging with health professionals, we're educating the community. Specifically now, it would be on extreme heat, and we're advocating for change. So this is just a quick overview of the CHOT, the Climate Health Outreach Team. Basically, it's just a bunch of young individuals who are volunteering and working to start conversations with providers on climate and health. The outreach team specifically is responsible for speaking with healthcare providers, but volunteering with FCCA, we also are educating and talking with the community. And this is the start of the presentation. This was basically when I was a CHOT representative. Myself and another individual made this presentation to the Jesse Charles Community Health Center. So this is just a sample overview of how we presented. And you can see the date was about 2 years ago. So the topic was health impacts of climate change. And at the time in 2021, there were 4 CHOT representatives. So you can see the 4 of us and myself and some Robbie is also in FCCA as well. And the other 2 individuals are not with us. So this is our CHOT outreach team. So obviously, the most common starting point with climate change would be the greenhouse gas effect. It's very important to understand this, to understand the rest of the effects climate change has on our Earth. So greenhouse gas effect is actually a good thing. It's what keeps our Earth warm, and without the greenhouse gas effect, we would be a frozen tundra, and it would be extremely cold to live on, to even have any organisms and sustain them. So the problem is that with lots of and increased amounts of human activities, the concentration of greenhouse gases in the atmosphere have increased. And therefore, what's happening is when outgoing heat is leaving and going into space, the greenhouse gases are actually absorbing that heat and radiating it back. So it's like having a blanket around the Earth, and therefore it's actually getting hotter. So it's a good thing that we are hot because we need that heat to survive as a planet. But unfortunately, the amounts of greenhouse gases that are radiating the heat is very much high, and that's because of human activity. And this graph here by NASA basically just justifies what exactly I said. We have increased the human activity, especially after the Industrial Revolution and after the 1950 level of carbon dioxide, which was at 300 parts per million. We have since then we have experienced a exponential level of carbon dioxide levels, and so in May of 2021, I think this number is much higher today, but it's at 416 parts per million carbon dioxide in the atmosphere, which therefore is contributing to excess heat. And so FCCA loves to use this acronym called heat wave to explain and better understand how climate change can affect our health. So there's many different avenues. One of them is heat illness, and this is one that we're focused on right now with our extreme heat project. E is for exacerbate heart and lung conditions, A for asthma, T for traumatic injury, W for water and foodborne illnesses, and A for allergies, V for vector-borne diseases, and E for emotional stress. So these all have an effect on our health, and they are being affected by climate change. So starting with heat illness. Heat illness is the leading cause of weather-related deaths in the US. And the people that are most at risk would be outdoor workers, elderly, infants, children. With the heat basically increasing because of climate change, with global warming, we are prone to heat-related illnesses, whether that be a heat stroke or a heat exhaustion, heat cramps, and so forth. And also the problem too is with the heat season coming up. This is between May and October. And this is where there is high temperatures above 90 degrees along with humidity for about 2 to 3 consecutive days. With this specific extreme heat pattern, that is where we are prone to or could be susceptible to contracting a heat-related illness. And this is something that we're trying to inform the community and healthcare professionals with our current project. And also one group I did not mention earlier that is very vulnerable to heat-related illnesses would be the homeless, because they are without shelter. And one of our preventative measures that we exercise towards the community is that you must drink liquids, seek shelter if you are feeling dizzy or high heart palpitations, etc. And unfortunately, with the homeless population, they do not have the ability to do that. So they are definitely at most risk. So next in our acronym is A for asthma and allergies. And pollen, heat, smoke, mold, air pollution are all effects of climate change, and they actually can make asthma worse by creating the following triggers. So when we specifically talk about asthma and allergies, we're focused on this issue of equity, and the burden falls disproportionately on some groups more than others, and those groups would be Black or African American and Latin communities, as they are more exposed to air pollution. So, unfortunately, with that disproportionate measure, there's higher rates of asthma, and they're more likely to die or experience health complications because of this. So this is a great infographic to just support the idea of how asthma and climate change are related. So essentially, climate change contributes to this in the first sense of cars, trucks, power plants. They're all creating air pollution. So the more, again, we talked about earlier, the human activities. So this use of transportation creates more air pollution, and climate pollution makes the world warmer. It actually contributes to more heat that is being radiated back and creating that blanket that we talked about in the first slide. And when it is warmer, air pollution gets worse, and then therefore, with more air pollution, it can lead to more asthma attacks. And this infographic also explains the link between allergies and climate change. So cars, trucks, industry, and power plants all create this climate pollution and air pollution. And then the climate pollution makes the world warmer and changes our climate. With more climate pollution, there is more pollen that is being created by plants. And then when warmer temperatures come around, such as springtime, the allergy season is actually longer because of this. And then the pollen from weeds, grasses, and trees will cause allergies. So allergies is actually being extended through the effects of climate change. Before it would, like if we were at normal carbon dioxide levels, then the allergy season would be much shorter. So vector-borne diseases is another big one, and living here in South Florida, we are definitely at risk with our warmer temperatures. So mosquitoes can be vectors for distributing following diseases to populations. So for example, as you could see here in the photo, this is an Aedes aegypti mosquito, and it is a vector for different types of diseases such as Zika, dengue, chikungunya, yellow fever. So with warmer temperatures that we are experiencing here in South Florida, and even in cooler temperatures such as North America, which are starting to warm up, allow insects to spread. It's basically a feeding ground for more mosquitoes. So as their season is lengthening, then we are more susceptible to these following diseases being spread around. And for example, ticks that tend to live in northern areas, when those temperatures are also being, when those cooler areas are also warming up, it's allowing for their season to lengthen as well, and for Aedes aegypti mosquitoes to also move into those cooler areas, which explains the last point of diseases spreading to new areas and populations. So if the whole entire planet is getting warmer, then it's not just the issue of, oh, South Florida or any country or state around the equator. It's actually increasing to our northern and southern poles. So now with E for emotional stress, trauma can stem from natural disasters, which can displace people, destroy their homes, their communities, affect their jobs, disrupting their daily routines and mode of transportations. So this can definitely lead to anxiety and depression and can affect our mental health. Also, heat waves being associated with heat-related illnesses can also, there has been an association with an increase of intimate partner violence, and this is a general threat of climate change, being the anxiety that's inducing all the changes that we're experiencing. So here, for example, in South Florida, we are experiencing higher levels of weather patterns, whether that be hurricanes, tornadoes, etc. And so this can definitely cause emotional stress as we have to prepare for any given hurricane, whether it's going to be a high category and destroy our homes, the anxiety that we may feel, and etc. So essentially, when we finish the PowerPoint presentation, we would ask the medical professionals what's their experience. Have they seen these relationships when they are examining their patients? And we tend to ask them these types of questions and just kind of get their feedback. And moving forward with the presentation, now we will discuss the clinician's role, how they can advocate. Because remember, we talked about earlier our three principles: we educate, engage, and advocate. So this is more of an advocacy part of the presentation, and how we can inform the medical professionals what they can do to actually make an impact on a more policy level. Sorry, I meant to say policy-based level. So, given that 71% of low income households have faced at least one civil legal problem in the last year, with those problems including improperly maintained rental housing, mold, broken screens, malfunctioning AC, these issues can cause health problems. So, with FCCA, we have developed this medical legal partnership program, which offers a series of letter templates that clinicians can give to their patients to request reasonable accommodations. So, this partnership is a method to allow the physicians to actually advocate for a solution for their patients. So, we definitely describe this to our audience on what we offer. And just one example is like, if there's a house that has this harmful black mold that you could see here in the picture, and then that patient that lives in that house has been seen for repeated visits of respiratory issues. And since this is limiting a major life activity, breathing, identified by Americans with Disabilities Act, the landlord legally has to fix it. So physicians can actually help patients request these accommodations through letter templates. And essentially, that letter states whatever the problem is, um, and what there needs to be done, the accommodation, and what's getting rid of. So in this case, it would be the mold. They need to fix the AC, or even terminating a lease early. So believe it or not, you don't just have power as a physician to treat the patient, but with FCCA, you can also do more than that on a legal scale. In terms of policy action, FCCA has been involved with the Miami Chief Heat Officer and Heat Task Force, which is what we're doing right now, partnering up with the county and educating and engaging the community on heat related illnesses and the extreme heat season coming up. Also, as I mentioned earlier, we are in coalition with the Miami Climate Health Working Group, and so they also have meetings monthly. And that's another way for physicians to get involved in terms of policy. And we also advocate for physicians to join FCCA, sign up for the newsletter, which is free. And presentations like this can be tailored for their clinic when they sign up. And lastly, at the end of the presentation, we would thank the physicians. And we also, in the beginning, we did a pre survey, and now we're doing a post-exit survey, which is just to see if their knowledge assessment has changed from the course of the presentation from start to finish. And so we would ask them to scan the QR code to do the survey. And we would thank them for their time and for listening to our survey, to our presentation, and you know, being engaged with the CHOT representatives. So thank you all.
So that concludes the presentation by Vida Kanaze. And just wanted to note that we don't expect our volunteers to give out presentations. However, we want you to be able to model your communications with the patients or health center staff just how Rita was able to communicate heat wave, the acronym heat wave, and other information regarding FCCA and resources that patients or health center staff may need. Next, we have the review of educational materials. First, I'll be going over the posters and handouts for the health centers. Then I'll go over the gift bags for the health center staff. After that, I will go over the gift bags specific for patients. And then there is a short section on instructions on how to use a cooling towel.
Over the FCCA project CHOT educational materials. The following will be distributed to our health center sites. First, I will be going over the posters and handouts that we will be distributing specifically to the health centers. Here we have the MDC Extreme Heat poster in English, Spanish, and Creole. This poster is 17 by 11 inches and contains information on how to protect yourself from extreme heat. The first section of this poster talks about who is at most risk during extreme heat, which are the following. So you have people who work or are active outdoors, such as your construction workers and athletes who are practicing outdoors, anyone who does not have access to air conditioning, infants and children, as they may have smaller body mass to surface area ratio than adults, which reduces their body's ability to cool down. Similarly, for pregnant women, their bodies have to regulate twice as hard in order to cool down themselves and the developing baby. Also, heat waves increases the chances of going into labor early, which results into having stillbirth or having low birth weight. And for those who are 65 and older, who likely have chronic medical condition, this changes normal body's response to heat, such as taking prescriptions. This can affect one's ability to control the temperature or sweat. Migraine and allergy medications and other vasoconstrictors, as well as tricyclic antidepressants, phenothiazines, anticholinergics, all reduce sweating, which is a key tool in temperature regulation. And as explained, people who experience chronic illnesses. The lower section of this poster is information on what you can do to prevent heat-related illnesses by staying cool, staying hydrated, checking on your neighbors and friends, and staying informed on weather forecasts. First, to stay cool, it is mentioned here that it is recommended for those who do not have air conditioning to go somewhere for a few hours each day, especially during high temperatures. It is also recommended to wear light-colored and lightweight clothing, as it is more breathable and you're able to be outside for much longer. When it gets too hot, taking cool showers can cool down your body, and avoiding direct sun by seeking shaded areas. Another heat-related illness prevention is staying hydrated. It is recommended to drink more water than usual. On a regular day, 8 glasses of water is recommended, and of course, if it's during extreme heat, more would be better. It is also important to check on your neighbors and friends in order to prevent heat-related illnesses in the community. This can be done by creating a buddy system, focusing on high-risk individuals, which we have discussed just a while ago, and checking in on elderly and those who do not have air conditioning units. Last, staying informed is key to prevention. There are many resources for checking weather forecasts, such as your local news, or even by using your personal cell phones. Be aware of extreme heat days, when it feels like 100 degrees or more. Most importantly, learn about signs of heat-related illnesses such as heavy sweating, clammy skin, cramps, tiredness, dizziness, headaches, nausea, confusion, and high body temperature. For more information, you can direct patients or health staff to scan the QR code on the bottom of the poster, which should lead them to the MDC Extreme Heat webpage. As mentioned, we provide a Spanish, Creole, and Creole versions of this poster as seen on this slide. Next, here we have the MDC Recognizing Signs of Heat Illness, which is a two-sided flyer, so we have a front and back page. Starting off with the front page, it talks about the dangers of heat waves, with the warning that elevated body temperatures can affect vital organs and that health conditions such as dehydration, obesity, and heart disease can make it harder for the body to cool down. Below, there is a dedicated space to write information for family emergency planning, such as medical conditions to be aware of, emergency meeting place, and emergency contact information. Next, we have cooling strategies on how to prevent heat-related illnesses. In the event of a heat wave, it is recommended to stay hydrated. Do not wait until you feel thirsty. It is also recommended to avoid drinking alcohol, caffeine, and sugary drinks, as that may cause you to go to the bathroom more frequently, which then leads to dehydration. Next is to seek a cool environment, so finding a cooling center in Miami-Dade, especially during heat season, which is from May 1st all the way through October 31st. Cooling centers may be open to the public for any life-threatening heat during heat wave, but be sure to note that there will be limited medical and hydration services on those areas. Next is to avoid strenuous activities and limit time exposed to the sun. Wear sunscreen if you do decide to go out, and especially if you're going to be outdoors for a long period. Here, another important cooling strategy and prevention of heat-related illness is not leaving infants, children, or pets in the car. Consider the use of backseat reminder systems such as Steelmate, Elfo, or Ride and Remind. All of those apps can make you sure that your infants and children or pets are attended to. Next is using the buddy system. Check on the health of your family and friends, especially if they are children, elderly, or with mental or physical disabilities. Next is wearing light-colored, lightweight, and loose-fitting clothing, and some head covering as well. Here, we also recommend using cooling towels, which you can soak in water and wring out the excess water and put the towel around your neck or areas in the body that will bring down the temperature, such as your armpits and your groin area. Taking a shower using cold water can also decrease your body temperature, and of course, keeping your home cool, closing out curtains, and avoiding cooking during the hottest parts of the days. That could mean from 9 a.m. all the way to sundown. And making sure that your ACs are running and are maintained properly. For more tips, you can visit the website that they have on the bottom of the flyer, which is cdc.gov disasters/extreme heat. On the right side of the flyer, it talks about who are the vulnerable population in our communities and how to recognize signs of heat illnesses. And of course, and most importantly, what to do in situations where you or someone you know is experiencing some heat illness. First off, vulnerable populations again includes infants, children, seniors, people with disabilities, pregnant women, people living alone, and of course your pets. For recognizing heat exhaustion, someone may start feeling that they are about to faint, they are dizzy, they experience excessive sweating, their skin is pale, cool, and moist to the touch, and they are also nauseous and or vomiting. They can have rapid and weak pulse, and they may start having muscle cramps. On the other hand, heat stroke can present with throbbing headache or confusion, no sweating at all, and the body temperature could rise up to 104 degrees Fahrenheit or above with red, warm, dry skin. They can also be experiencing nausea or vomiting with rapid and strong pulse, and they may lose consciousness. As for what to do, it is important to know that for heat exhaustion, move the patient or someone that you know who are experiencing heat exhaustion to a cooler place. Stay hydrated. Make sure to give them some sips of water. Use cold compress or take cool showers. And call 911 if symptoms worsen or last longer than an hour. As for heat stroke, it is highly recommended to call 911 immediately, as heat stroke can be fatal. Next, it's also important to remember to not give them anything to drink, as that may cause them to not be able to breathe properly. And also, of course, make sure to move them to a cooler place in order to be relieved of some of the symptoms. Here is the second page of the MDC Recognizing Signs of Heat Illness brochure. Here we have emergency medical care information, so it lists all the hospitals in the Miami-Dade County and their contact information. It also shows the different levels of emergency, especially for pediatric patients, who to call, what's the address. Those information can be found here. Also, it gives you some guidance on how to prepare for basic emergency by preparing your emergency kits. So for 2-week supplies, make sure you have water in sealed, unbreakable containers, non-refrigerated food, prescription medicines, and treatment information. Also, be sure to pack your face masks, hand sanitizers, sanitizing wipes, and gloves. Make sure that you have change of clothes, mobile phone in case of emergencies, whistle to signal for help, first aid kit and toiletries, important documents, family emergency plan, which we've discussed in the previous slide, flashlight with extra batteries stored separately, sunscreen, radio, solar-powered battery bank, trash bags, duct tape, and cash and small bills. It is also recommended here to create 2 kits. One is a home kit. It could be any size container, and the second one would be a ready-to-go kit, which is more portable, and you can have it in your car or at work. It's easy to carry and something that you can have on hand for convenience. And especially important to take notes of what is needed for infants, for children, seniors, and pets. So for infants, that could be your formula, baby food, diapers. For children, for entertainment, you have their toys and books. And for seniors, some spare glasses, hearing aids, hearing aid batteries, and medication. For pets, their medication, muzzle, collar and leash, pet waste bags, and food. For more important resources, here are some highlighted information from the local radio stations, how to get prepared, and some apps that you can download on your personal cell phones, just like the Ready Miami-Dade app and OSHA NEOSH Heat Safety Tool app. And more conveniently, there are more resources located on the right side of this flyer, some different websites and contact information that you can have on hand. And this was created by Emergency and Preparedness and Heat Events, the Miami-Dade County Emergency Management, and was sponsored by the Miami-Dade County Office of Resilience. Next, we have Surviving Extreme Heat. So this flyer was created and developed by Dr. Todd Sack, which is also the founder of My Green Doctor Foundation. And this flyer is specifically a guide for health professionals. And the first part of this flyer is information on being safe during extreme heat emergencies. So, what to do and not to do during hot days. So, for what to do, take precautions when the temperature might be 90 degrees Fahrenheit or 32 degrees Celsius or warmer, especially or even more so when humidity is high. Stay indoors, close the curtains, stay cool with showers or wet towels. Now, this is something that we like to highlight whenever we are discussing this flyer to health professionals or even mention to our patients when we do go out to our site visits, is that it is more safe if you turn off the fan if it's over 95 degrees Fahrenheit, because at that point you are just circulating hot air inside the room that you are in. Again, and I will be repeating this, one thing we recommend is to wear loose and light colored clothing plus a hat if you decide to go outside. Drink lots of water, seek a cool shelter. That could be again your shopping mall, library, movie theater, local cooling center, or stay with a friend with air conditioning. Check on your neighbors and pets who may need help and call 911 if you experience weakness, dizziness, shortness of breath, or chest pain. Call 911 if you experience weakness, dizziness, shortness of breath, or chest pain, or for advice. What not to do on hot days. Do not do strenuous activities, exercise outside on hot days. Do not barbecue, have open fires, or use non-essential machinery on hot days. Do not drink alcoholic beverages, and never leave your elderly people, children or pets alone inside a vehicle, not even a minute, not even on a cool day. And on the center of the flyer, we have information on protecting your community. So this is more a wider scope or a wider point of view on how to make changes in our community. So first, we ask our community leaders to plant trees and create parks and other green spring to warn people about heat's dangers and how people can protect themselves. Create safe, air-conditioned shelters where people can go on very hot days. Plan to contact and transport the poor, the elderly, or other vulnerable residents during a heat emergency. Enact building codes requiring white roofs instead of black and encouraging energy-saving designs, use of solar electricity panels, and of low-energy appliances. Create a website and a telephone hotline where people can learn what services are available to them. If you need more information, you can go to www.mygreendoctor.org or also check out our webpage at www.floridaclinicians.org. Here we have the back page of the Surviving Extreme Heat brochure. And this side of the trifold brochure is information on what is extreme heat, signs of heat illness and heat exhaustion, and also some guidelines on what to tell your patients when you are discussing with them about extreme heat. First, what is extreme heat? Extreme heat is a period of high heat and humidity with temperatures above 90 degrees Fahrenheit for at least 2 or 3 consecutive days. A combination of high heat and humidity can lead to heat-related illnesses, including heat cramps, heat exhaustion, and heat stroke. And a fact to be aware of is that more than 30 people die in Miami-Dade County each year due to heat illness. Most vulnerable are the elderly, children, and unhoused, the physically disabled, people with mental illness, pregnant women, those in older homes with poor insulation and without air conditioning, tourists that may not be aware of or are acclimated to the weather, and those who work or exercise outdoors, such as your farmers and your construction workers. Warmer temperatures convert air pollution into dangerous smog, resulting in more asthma attacks, bronchitis, heart attacks, and deaths. More people get sick each year as extreme heat events become more frequent and more severe, as shown on the EPA graph from 2022. So it shows the average number of heat waves per year and the heat wave frequency. On the center of the trifold page, we have the vulnerable populations again highlighted at the very top, which are your pregnant women, newborns, and children. And it also gives you the signs of heat illness and heat exhaustion. So some early signs could be increased sweating, thirst, and muscle cramps. It's advised to seek shelter immediately, rest, and drink liquids. For heat exhaustion, again, it's heavy sweating, thirst, fatigue, decreased urine, weakness, headache, nausea or vomiting, cold, clammy skin, dizziness, or fainting. It is advised to seek medical attention immediately. For heat stroke, it could present as throbbing headache, fast pulse, profound weakness, hot, flushed, dry, or damp skin, mental confusion, loss of consciousness. It's often fatal and requires hospitalization. And for warning, heat stroke is much more common than a decade ago, but preventable, so watch for the early signs. On the right side here, we have what to tell your patients when you are talking with them about extreme heat. So for preparation, have fans ready in your home if you do not have air conditioning. Keep your air conditioner fit by having it inspected annually, changing the filters every 3 months. Know where your family and you will go during a hot day. If the air conditioning fails or electricity fails, again, it could be your cooling centers, library, malls. Know what medicines and documents you should take if you must leave your home. Remember to plan for your pets. Warn visitors of to acclimate to a hotter region. Know what medicines increase the risk of heat illness, such as diuretics, antihistamines, phenothiazines, antidepressants, antipsychotics, some antibiotics, and others. Contact your neighbors who may need help in heat emergency, such as the elderly, disabled, frail, mentally impaired, and unhoused. And as hot days worsen, air pollution, be aware of your local air quality every day. Now, with forest fires happening more frequently, more and more people are experiencing worse local air conditions. So, this is something to be aware of. And you can visit the website www.airnow.gov, which will tell you the air quality of your neighborhood. And of course, use the QR code here to read how to protect your family from heat illness and air pollution. Just like the poster, the Surviving Extreme Heat trifold brochures are available in Spanish and in Creole. Now we are going to go over the educational brochures that we hand out to health center staff and are all included in the gift bags that we provide to them. First off, we have Climate Impacts Health brochure, which shows you the problem of climate change, the impacts of climate change, and some solutions that we can do in order to fight against the changing climate. First, with the problem, as it mentioned here, climate change is harming our health now. Everyone is affected, but some people are more vulnerable. If we do nothing, these health threats will increase. As for the impacts, there are in total 8 impacts that we have created an acronym for, but there are 4 categories to remember. So there's the direct impact, so your extreme heat, your air pollution, and extreme weather. And there's also a spread of disease from insects and other vectors, from contaminated water and food. There is also a disrupt food supply chain, and that could cause or lead to hunger and malnutrition. And again, very last here is disrupting your well-being from the emotional stress, maybe because of the impacts on your health, you're not able to go to work, which then again exacerbates any mental stress that you are having. As mentioned, there is a easy way to remember the 8 impacts. Just remember heat wave. H stands for heat illness. E stands for exacerbated heart and lung conditions. A is for asthma. T is for traumatic injury from extreme weathers. W stands for water and foodborne illnesses. A is for allergies. V is for vector-borne diseases. And E is for emotional stress. Some solutions that we can do is to clean energy, reduces harmful pollution, and protects the climate. Active transportation, such as biking, walking, and improving our public transit, which will promote healthier lifestyles. And of course, eating less red meat is good for the planet and good for our health. For more information, you can also check out the www.medsocietiesforclimatehealth.org for, again, more information to engage, educate, and advocate. Next, we have heat stress overview with the subtitle Understanding Heat Stress can help you to stay safe while working in hot environments. So things that you need to know: heat exposure can cause a range of effects on your body, from irritating rashes to heat stroke, which can be fatal. Heat exposure can cause confusion and poor judgment. Use the buddy system to monitor coworkers for heat illness. Drinking enough water is critical to preventing heat illness, so stay hydrated. Cooling is the treatment for all heat illness. Factors that can contribute to increased heat illness risk: if there is high humidity, lack of wind or breeze to cool the body, dehydration, lack of acclimatization, if you are aged 60 and above, if you are wearing protective gear, including non-breathable or minimally breathable clothing, respirators, and chemical-resistant apparel. If you have a history of heat illness or recent illness unrelated to heat that could exacerbate dehydration, certain health conditions, medications that you take, and physically demanding work, especially if you are outside. Recent alcohol use within previous 24 hours could also increase dehydration and risk to heat illness. For workers, please look out for one another. Use a buddy system. Often it is a coworker who first notices signs of heat stress in another employee. On the right side of the flyer, there is an easy way to distinguish different types of heat illnesses and its severity. To start off, we have heat rash. So red cluster of pimples or small blisters, usually on neck, upper chest, groin, under breasts, and in elbow creases, where you can see red patches, and it's considered less severe. It can lead to then your heat cramps, muscle cramps, pain, or spasms in abdomen, arms, or legs due to dehydration. It could also then worsen into heat syncope or fainting, dizziness, lightheadedness after prolonged standing, or suddenly rising from a sitting or lying position. Heat exhaustion, as we mentioned in the other flyers, can be presenting as a headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature, decreased urine output. And which is most or often fatal is your heat stroke, confusion, altered mental status, slurred speech, loss of consciousness, hot, dry skin or profuse sweating, seizures, very high body temperature, fatal if treatment is not given immediately. Moving forward with the staying safe in hot weather, this one is developed by the NIH from the National Institute on Aging. So it shows you very clearly with pictures the signs of hyperthermia or high body temperature. Again, can lead to dizziness, muscle cramps, swelling in your ankles and feet, nausea and weakness, and a rapid pulse. Next, we have tips to prevent hot weather illness. So drink lots of liquids. Again, limit your caffeine and alcohol. Wear light-colored, loose-fitting clothes. And if it's too hot outside, it is best that you stay indoors and exercise with roof over your head. To learn more about staying safe in hot weather, please visit www.nia.nih.gov/hot-weather-safety. Next, we have a very direct and easy to read heat exhaustion versus heat stroke educational flyer. For heat exhaustion, act fast, move the person to a cooler area, loosen their clothing, sip cool water, and seek medical help if symptoms don't improve. Remember that heat exhaustion can then lead to heat stroke, and if these symptoms persist, such as dizziness, thirst, heavy sweating, nausea, and weakness, it is best to ask for medical help. As for heat stroke, it can present as confusion, dizziness, and becoming unconscious, which can lead to death or permanent disability if not treated immediately. So act fast, call 911, move the person to a cooler area, loosen their cold clothing, and remove extra layers. Cool with water or ice. Here is our heat check magnet. This is something that patients or our health center staff can put on their refrigerator doors, and easy to remember prevention actions such as drinking water, finding shade, and getting rest. There's also a QR code that can lead them to the www.miamidade.gov/heat website where they can learn more information on extreme heat and how to protect themselves. Here is our weather alert fan heat wave. which is very sought after, but we do only provide this to our health center staff. And as you can see, the front page has a weather alert, heat wave animation here. And again, it gives you a very short and sweet reminder of what to do, especially on high temperatures, such as drinking water, finding shade, getting rest, check on seniors, your babies, and your pets. At the back side, you have the heat-related illnesses, what to look for, and what to do. So again, it lists the different heat-related illnesses, starting off with heat stroke, heat exhaustion, heat cramps, sunburn, which we didn't discuss, but it is a painful red, warm skin, and blisters on the skin. And some things that you can do is to stay out of the sun until your sunburn heals, put cool cloths on sunburned areas, and take a cool bath. Put moisturizing lotion on sunburned areas and do not break blisters. And of course, lastly is the heat rash. So gift bags for our patients is a little bit more differently, but contains most of what we've already discussed, such as the climate impacts health flyer. You have the heat stress overview. They also get the staying safe in hot weather, heat exhaustion versus heat stroke, and the heat check magnet. Lastly, I will be going over the instructions on how to use a cooling towel. Please note that this is not something that we provide to the health center staff, nor to our patients. So this is just printed and laminated for demonstration purposes only. First, you soak the cooling towel into water. You wring out the excess water, you shake it 3 to 5 times, and then you can wear it around your neck, just like how it is shown on this picture. Thank you everyone for completing the session 2. As I mentioned, these are all the educational brochures and flyers that we provide the health centers and the staff and patients. However, realistically, you wouldn't necessarily have all the time to go over each of the educational flyers, but it is important for you to review and know the contents of the educational flyers, just in case the patients or the health center staff has any questions, that you can point them to the right information. Again, thank you so much for finishing the session 2, and I will see you at the next section.